One of the addiction areas where the evidence for pharmacotherapy or medication intervention is strongest is actually when looking at alcohol. And for a long time, there was really only one licensed medication in South Africa to treat alcohol use disorders, and that was a drug called Antabuse or disulfiram. This is a terrible drug. It causes people to have a hypersensitivity reaction to alcohol. So in anyone taking this drug, even the smallest amount of alcohol will cause them to become physically very ill. Vomiting, diarrhea, flushing, sweating, nauseous, and in some instances, people have died because of taking this medication. When this medication is prescribed to patients, the patients are also not told about hidden forms of alcohol. For example, mouthwash, Listerine mouthwash, will give us hypersensitivity reaction. Or BioPlus has got a small amount of alcohol in it as well, which can cause a sensitivity reaction. So for that reason, personally, I don't prescribe Antabuse or disulfiram. It's analogous to hitting a dog when the dog does something that you don't want it to do. Of course, the dog learns eventually not to do that behavior, but the dog learns out of fear. And when that fear is no longer present, or when the person is no longer taking that medication, it's very easy to resume that pattern of substance use again. And in fact, when one looks at the literature, there are 3 randomized control trials looking at Antabuse. 2 are overwhelmingly negative. 1 was supportive, but it took place in a very regimented, fixed treatment setting where there was no access to alcohol and the patients were forced to take the medication. So obviously, it's going to work. But when one looks at real-world populations and sort of real-world studies, it's a completely ineffective medication. But thankfully, there are 2 other medications that are licensed for use in South Africa and that are available for use in South Africa. And these are a medication called acamprosate and a medication called naltrexone. And either one of these 2 medications has got its own potential benefits. Acamprosate is most useful for people that have gone through a detox and are wanting to remain abstinent, and in fact functions almost like an artificial alcohol, but doesn't cause people to become intoxicated. But it helps regulate the dysfunction that has occurred in the brain as a result of chronic alcohol use. If one compares that to a medication called naltrexone or Naltima, naltrexone is the most useful drug to take for people that are wanting to reduce the quantity of alcohol that they drink and reduce the frequency with which they drink. And the important thing is that both of these medications have mild minor side effects, as any medication that you take, but are not dangerous, are evidence-based, as in there's good evidence that they work, and are reasonably affordable when one considers the cost of alcohol. And for a long time, or maybe not for a long time, but psychiatrists and doctors in general seem to be unaware of these medications. It might reflect poor marketing on the part of the company. For reasons unknown to me, the drug companies in this country are not as aggressive in marketing these drugs as they are with other drugs, for example antibiotics and antidepressants and statins.